to one and all present here. Sorry, judges, I am not doing this. My hand is doing this. Yes, my answer is strange to you, right? I am B. Siddharth Singh from Shan Academy, Kamakoti Nagar, here to explain you about a strange topic. The human body is a machine. It is prone to occasional malfunctioning, most of which are termed as diseases or illnesses. While we know diseases ranging from common hiccups to cancer or tumors, I am here to say about a medical condition that seems unreal, which is alien hand syndrome, also known as Dr. Strangelove syndrome. You'll be so curious to know about this. Here we go. Alien hand syndrome. Alien hand syndrome is a neurological disorder in which the afflicted person's hand appears to take on a mind of its own. The hand may undertake movements on its own without any conscious control, including reaching of objects, caressing, or even slapping oneself, as if being controlled by another person. Sometimes a person may have to use another hand physically to restrain the alien hand. Alien hand syndrome usually occurs when a surgery separates the two hemispheres of the brain. It can also be caused after a stroke, trauma, tumor, or even cancer. Let's see who discovered it and when it was discovered. First, it was discovered by Dr. Hugo Liepmann in 1905 and Dr. Kurt Goldstein in 1908. Dr. Liepmann drew attention to the unilateral disinhibited grasp reflex to tactile grasp reflex to tactile apraxia after cerebral injury. Dr. Goldstein first connoted the term alien to respective grasping, the impression that an alternative entity is responsible for the behavior. Now, let's see short facts about its history. AHS was first identified in the year 1909, and there have been only 40 to 50 recorded cases since. It's believed that other instances may have been misdiagnosed as a part of an existing mental health disorder. The rarity and non threatening nature of AHS has led to infrequent research and a lack of hard data, resulting in a condition that's largely mysterious. Very recently, however, no clues have been uncovered that help pinpoint the part of the brain that is active during AHS episodes. Now let's see its symptoms. The sufferers of alien hand feel that they have no control over the movements of the alien hand, but that instead the hand has the capability of acting independent of their conscious voluntary control. Alien hands can perform complex acts such as undoing buttons, removing clothes, and manipulation of tools. Whatever activity the patient performs with their right hand would be mimicked by their left hand. This is known as mirror movements. Now let's see its types. There are two types called involuntary grasping and self-opposition. The normal grasp is like holding the pencil normally, and alien hand syndrome grasp is like holding the pencil almost like breaking it. Now let's see self-opposition. The self-opposition is if I wear my specs in my right hand, the alien hand would automatically remove it. This is self-opposition. Let's go to clinical manifestation. There are two major types called as frontal variant and callosal variant. The frontal variant commonly affected areas are supplement motor area, cingulate gyrus, and corpus callosum. The common causes are tumors, infraction, and trauma. The symptoms and signs are groping, grasping, and utilization behavior. The callosal variant. The callosal variant commonly affected areas are corpus callosum. The common causes are collosotomy, tumors, and infraction. Symptoms and signs are intermanual conflict. Here are the gifts of alien hand syndrome. I'm sure you'll be so curious to know how the brain works during the episodes of alien hand syndrome. Let me explain about it. Brain function of alien hand. Due to damage in the medial motor frontal region of the brain, disconnection occurs between different parts of the brain that are engaged in different aspects of the control of the bodily movement. Result of damage to corpus callosum as the brain's email server. If there is a disease, there should be treatment. I'll explain its treatments. Alien hand syndrome does not have any treatment. Therapies and pharmacologic options for alien hand syndrome lack development. But scientists are working on treatments to reduce the symptoms. People who have alien hand after a brain illness or stroke may recover after some time. However, recovery is less successful for people with neurodegenerative diseases. The condition may be treated or managed using muscle control therapies such as botulinum toxin Botox or neuromuscular blocking agents. There is also a movie called Dr. Strangelove. Dr. Strangelove, or How I Learned to Stop Worrying and Love the Bomb. Strangelove was inspired by the real life thinking of Herman Kahn, one of Ellsberg's colleagues at RAND. Kahn's words are actually quoted in the movie. He was a wheelchair bound nuclear war expert and a former Nazi. The year of the film is 1964. The YouTube link for the film is given in my PPT. If you wish, I can also share it in the chat box. Thank you for the opportunity and have a wonderful day.